Rewarding careers, experiences of a lifetime. Explore travel PT at aureusmedical.com. AUREUSmedical.com.
NPTE StudyCast.
Welcome back to NPTE StudyCast. I'm your host, physical therapist Jimmy McKay. Bringing back Matt Tuttle to the program. Matt, welcome back.
I appreciate you having me back again, Jimmy. These are an absolute blast to work on.
Staying around the knee, that's your wheelhouse. What pathology are we looking at today with the students?
Yeah, I think discussing ACL rupture and ACL injury would be pretty beneficial.
Yeah, a guy working with the Denver Nuggets and professional basketball players knows, unfortunately, something about ACL rupture. So how do you describe the pathology briefly if you were going to be a PT student focusing on the NPTE?
Trying to keep it simple, I would just say this can include a partial or full tear of the anterior cruciate ligament of the knee. This ligament is really restricting anterior translation and rotational stress of the tibia. Then I would say that, it's important to note that this ligament can be injured in both contact and non-contact mechanisms. Maybe a little bit of bias that it's one or the other, but both events can injure this.
Yeah, good point, because that can be presented a couple different ways on in a test question for the NPTE. So good point.
Anatomy.
What's involved looking at an ACL rupture? Obviously the anterior cruciate ligament, but some other things involved with that type of pathology.
There's a lot of considerations here. The first one would be the origin and the insertion of the ACL, where you may have fractures at those locations either. So the femoral origin or the tibial plateau can also fracture during this injury. Other things that are worth checking and need to be checked would be a meniscal injury, whether medial or lateral, MCL injuries, and then occasionally you'll see chondral lesions, bone bruises, or like a posterior lateral corner injury may also go with this. So not taking for granted that you just got a positive Lockman and that this is just an ACL tear, but continuing to investigate what else may be going on.
Special tests.
Tests. This is somewhere where I think we bring in those special tests to prove it or disprove it. What's your list? How do you go through an assessment of a potential ACL rupture?
My bias here is to keep it simple, right? It's just to discuss Lockman and anterior drawer, but also when talking about those tests is to say that a lot of times these tests may not be positive, or you may not feel that translation of the tibia because individuals may be guarding. So remembering that a positive test here is the anterior translation and not getting a clunk, and not just, oh, hey, I pulled on it and it moved a little bit. Like, it is drastic when you feel one of these for the first time. If your patient's guarding, you may need to go to something besides one of these two tests.
Okay, so let's go down the line in terms of presentation, and then we'll get to imaging.
Generally, these individuals will report laxity, and there's oftentimes an inciting event. They'll mention an inciting event, whether it's their knee buckled, they were cutting, they felt their knee give way, or they were hit while playing a sport, whether it be like a soccer or football, and somebody takes a helmet to the knee. Their actual clinical presentation on the table, there will be kind of a pure joint effusion, not just knee swelling, pain guarding that increased laxity with the test, and they oftentimes will report a feeling of instability while they're walking. So those are the ones you really want to catch on to when they walk into the door.
And PT's not performing imaging or ordering imaging a lot of the times, but what are some of the things that you'll see in someone with an ACL rupture?
I mean, the gold standard obviously would be to get an MRI, but on top of that, there's also some X-ray findings, what they call notch findings. They can indicate an ACL tear if the individual just had an X-ray and not the MRI.
Differential diagnosis.
Differential diagnosis. Some other things to consider when you're trying to rule in or rule out an ACL rupture. What are some other things that it could look like?
Sometimes these are mistaken for meniscal injuries. And then also some of the other stuff that we mentioned above, whether it's an MCL injury, maybe a PCL injury. So really any of the ligament structures around the knee, we throw LCL in that as well. But there are times that people can also just have a low-grade sprain, not have their like a full rupture, and still have some positive tests here. So it's important to keep all the structures around the knee in mind, work through an appropriate testing structure for them.
Treatment examples.
Treatment examples for ACL rupture. There's a couple different routes that you can go in rehabilitation treatment.
Yeah, I think we oftentimes as a profession gets stuck on, we hear copers versus non-copers. So are there individuals that can get away with having a torn ACL and continuing to return to their prior level of function? There absolutely is a group there, but the more traditional route and definitely the stronger or higher portion of the population are the non-copers. So it's surgical intervention. And then there's a big discussion about graft types, whether it is a hamstring, a patellar tendon, you see some maybe hamstring tendon grafts. And then also, are there times that a cadaver graft may be appropriate? There are these two pockets, but most people are going to fall into that non-coper, needs surgical intervention. Post-surgically, early on, is to restore range of motion and then proceed to build into some lower quarter strengthening. At some point, down the road, start looking at hop testing and limb symmetry index. So how strong is their surgical side versus their non-surgical side? And kind of having a goal of wanting this to be above 95% before returning these individuals to sport.
Here's your example question.
And everybody's favorite part of the show, students love to get those sample questions. What do you have to throw at the students in ACL rupture for the NPTE?
These questions could go a lot of different directions just because it is such a big topic. I think one that is reasonable would be an athlete reports being hit on the lateral aspect of their knee while playing football. They report a pop and immediate joint swelling. This patient has an MRI scheduled for tomorrow. What special tests could help to determine a potential ACL injury?
All right.
A, McMurray, B, posterior drawer, C, anterior drawer, or D, Thessaly.
All right, where's your head go in terms of the best test to determine potential ACL injury in this situation?
Absolutely. Of those four, the answer is C, the anterior joint.
Perfect. Taking a look inside ACL rupture, what you need to know to pass the NPTE with Matt Tuttle here. Matt, appreciate you stopping by to share some knowledge.
Absolutely. I appreciate you having me.
Download free study guides now at aureusmedical.com/NPTE StudyCast. aureusmedical.com/NPTE StudyCast. Rewarding careers, experiences of a lifetime. Explore travel PT at aureusmedical.com.
NPTE StudyCast. Brewed by the PT Pintcast.